Welcome to this revision session on the use of entrustable professional activities for dentists and dental nurses working under general anaesthetic. This session is brought to you by the Paediatric Dentistry MCN for the East of England and University of Cambridge Professional and Continuing Education. In our clinical careers, we go from being novice to competent to expert, and this is the journey that we all take throughout our clinical careers. With the use of entrustable professional activities, we will see how this can be a useful tool for showing competence for dentists and dental nurses working under general anaesthetic. There are the national standards and guidelines and competencies, and in this video we'll focus in particular on how you can show your learning and use that learning as part of the framework for your entrustable professional activities for working under general anaesthetic. The General Dental Council standards state that you must work within your knowledge, skills, professional competence, and abilities, and that you must only undertake work for which you are appropriately trained, competent, and confident. But what does trained, competent, and confident look like? As a undergrad, you will have had lectures and seminars, exams and assessments, and you will have received a dental degree. But in the UK, the undergraduate dental curriculum does not include planning for or working under general anaesthetic. New guidelines for the use of general anaesthesia in specialty care dentistry were published in 2022. These new guidelines supersede any previous or existing guidelines or documents on the use of general anaesthetic in specialty care dentistry. Within the guidelines, there are specific sections on education and training standards for dentists and for dental nurses and anaesthetists. It's worth noting at this point that dental therapists and dental hygienists, it's not within their scope of practice to work under general anaesthetic. Within the guidelines, there are proposed competencies for dentists and for dental nurses working under general anaesthetic. And again, that's part of that journey in going from being novice to being competent to being expert. At first glance, the table of the proposed competencies may look quite complex, but let's divide this down and make things a little simpler to understand. There are three domains: preoperative, perioperative and intraoperative, and postoperative. And each of these has sets of knowledge, intellectual skills, practical skills, and personal attitudes and behaviors. So essentially, the knowledge, the things you need to know, the intellectual skills, the way in which you need to be able to use that knowledge, the practical skills, those hands-on things which you can do, and then the personal attitudes and behaviors, looking at the professional interactions and the professional behaviors. Within the competency descriptions, it says that on completion of training, then the dentist planning or delivering dental care under GA should be able to, and for example, in the preoperative domain, under knowledge, should be able to describe the role of general anesthetic. For intellectual skills, should be able to evaluate. So you're going from describing to evaluating. And then for practical skills, should be able to organize. So you're going from knowing to knowing how to doing. And then within personal attitudes and behaviors, should be building those professional relationships with colleagues outside of the immediate dental team. There are 2.5 pages of the proposed dental competencies for the dentist, broken up into the preoperative, peri and intraoperative, and postoperative domains. For the dental nurses, there is 1 page, and that reflects the different scope of practice for dental nurses working under general anaesthetic. So going from novice to experienced to specialist, at the moment this training and the EPAs really are designed for those who are at the novel and perhaps the more experienced level. And it's the specialists who have had specialist training, which covers working under general anaesthetic, who can be your guiding educators through this. The Getting It Right First Time supplement to the National Report on Hospital Dentistry looks at community dental services. And within this, there is my research poster on the use of entrustable professional activities within the dental teams working under general anaesthetic. When we think about entrustable professional activities, let's look at the definition, which is an EPA or EPAs are units of professional practice that can be fully entrusted to an individual once they have demonstrated the necessary competence to execute them unsupervised. And the difference between a list of competencies and an EPA is that each EPA will be a particular thing that you can carry out start to finish. It will incorporate a number of different competencies within there. So the competencies are the small building blocks. The EPA is what you can do using those building blocks. With entrustable professional activities, that's often shortened to EPA. When we look at the wording in the guidance for the competencies, it says that the dentist or the dental nurse should be able to. Let's think about rephrasing that slightly as the dentist or the dental nurse should be trusted to. And with those levels of trust or the levels of entrustment within EPAs, there is the introductory level, which is where direct entrustment and direct supervision is required. Therefore, you need that more experienced other. You need that specialist directly looking over your shoulder and supervising and intervening. The next level is where you are more experienced and the supervision and the entrustment is reactive. So the specialist or the educational supervisor is nearby, is available for support or intervention as needed. And then that moves on to the distant level of entrustment where they are available, but perhaps not even in the same building, but they are there to support you as and when needed. And then that leads to the unsupervised level of entrustment where you have been now trusted to work without any supervision because you've demonstrated step by step that you have the competencies and you have the knowledge, the practical skills, the attitudes, and the professional behaviors to be able to show that you can be trusted to carry out these particular entrustable professional activities related to dental working under general anaesthetic. In the GIRF report, then it has divided the domains into perioperative and intraoperative as that middle domain. And in this, we look at the EPA domains within this, looking at multidisciplinary team communication, WHO, safer surgical working, theatre etiquette, and airway management. And this is an example of the EPA list for the intraoperative and perioperative domain. So things like leading the WHO Safer Surgical Working in Theatre, including leading the team brief, debrief, and overseeing the surgical count. You can see that that encompasses a wide variety of individual competencies, but they all add up to that particular entrustable professional activities of being able to lead that WHO Safer Surgical Working within theatre. In the GIRF link, then there is a link to Future NHS where you can log in and get Word documents of the competency logs for dentists and for dental nurses. And these are Word documents. If you click there, you will be able to download this. And then that gets you a copy of the competency log, which is an important part of showing your journey from being novice to being competent to being expert. The log is laid out in such a way that the table of the proposed competencies has been made into a template which you can start to fill in and write in. So each competency descriptor at the top of the page, and then some space, as much space or as little space as you need to be able to fill this in. You can fill this in digitally by typing straight in, or you can write by hand, having printed it out. And here's an example of what two dentists have written in on there. And you can see slight variations in how people are using this. You don't have to have every section filled because it may be that writing in something once is all that particular learner needs. to demonstrate their engagement if maybe somebody else is writing in quite a lot more. And here is a close-up of what Dr. Ramesh had written. Here is a close-up of one of his colleagues. You can also print this out and write it in handwriting. And with any of these, as long as you can bring this to your appraisal and have a way of using this for demonstrating your development. With the levels of entrustment, you're going from direct to reactive to distant to unsupervised, and the entrustable professional activities are listed on the left with the levels of entrustment across the top. And as you are developing, you can develop and get these entrustments collected step by step. With entrustable professional activities, the evidence that you need will be your own learning log, the evaluation of a more experienced other, leading to that entrustment. So you're going from being novice to being confident to being expert. And this can involve engagement with a dental team, such as a specialist, the clinical lead, the consultant, or the educational lead. But also remember to engage the MDT team, the anaesthetists, the other theatre workers, to be able to help you in compiling your entrustable professional activity log, because these are things that the theatre staff can entrust you to carry out as well. Reflection is highly important in any form of learning, and using Rolf's reflective model, you can think about what happened, what was the impact of that, now what am I committing to doing differently for next time, and then background that reflective cycle again. So here are some examples of this in practice. We have a dentist who wasn't quite sure about whether general anesthetic was indicated for this patient. That was causing them stress, causing the patient stress. They engaged and learned that by engaging with colleagues and the guidelines, then this reduces the doubts. And now they're committed to action plans and smart objectives for next time. And again, this is reflection based on LMA Airways, and this led to the introduction of ET and NT tubes being used for examination under general anesthetic. The dental nurses also have their reflective log, and again, you can see from this the various levels of engagement with this. And again, that can be done in handwriting as well. So with the three domains, also thinking about the GDC, your CPD, and your personal development plan, you'll already have access to your enhanced CPD guidance. And in your appraisal, you'll be using this to populate your personal development plan and your education outcomes for the year in line with what you need for working under general anesthetic. You're going to plan, do, reflect, and record. I've added some additional resources, such as from NHS e-learning, the Association for Perioperative Practice, for example, the surgical instrument count, perioperativeCPD.com, for example, on intubation and airways, and articles from the BGJ. With entrustable professional activities, you are showing that you are trained, competent, and confident in the education and training standards for dentists and dental nurses. You're showing that you've engaged with these competencies, that you're going from being novice to being competent, being expert, that you're recording all of this step by step, that you have an annual appraisal, a PDP, and a log of your learning, and that with the entrustable professional activities, by engaging with the more experienced other, you are showing that you can now be entrusted, unsupervised, to undertake working under general anesthetic. If you have any questions on working under general anesthetic, on dental education, or on EPAs, please feel free to contact me. My name is Thomas O'Connor. I am Assistant Professor of Dental Education here at the University of Cambridge, and my email address is tjo36@cam.ac.uk. Thank you.